At the Center for Colon and Rectal Surgery, we think we're in the knowledge business. So what we do is generate knowledge, disseminate knowledge, and utilize knowledge. To generate knowledge, we develop new techniques and technologies that we can use to help our patients.
You know, we've gone from big incisions to smaller and smaller incisions, and now we're able to use endoluminal surgery and other advanced techniques that we think can really catapult us into the next phase of surgery.
Well, I think it's always important to generate new ideas and new innovative treatment options for patients, because it's always with the quest of improving their care, improving their outcomes from these diseases, and attempting to cure patients of these diseases with much more ease than we currently do.
And what we can do is use information from CT scans and MRIs to have real-time information that lets the surgeon know precisely the field and plane of dissection so that the operations can be carried out more precisely and in higher quality with less morbidity. And these are the things that we're pioneering right here at the Center for Colon and Rectal Surgery.
TAMIS, or transanal minimally invasive surgery, was developed at Florida Hospital by myself and others in the Center for Colorectal Surgery as an obvious solution to a problem of gaining access to perhaps one of the most difficult areas in the human, the lowest part of the pelvis and rectum, and was developed where otherwise it would have utilized specialized instrumentation or access through the abdominal cavity in a much larger operation.
When it comes to dissemination of knowledge, we have a strong program here of teaching and education for our local surgeons and residents and fellows, but most importantly we run regular courses and have trained more than 100 surgeons from around the world in specific minimally invasive techniques applicable to patients with rectal cancer, for example.
So the Nicholson Center is an advanced training facility where we see multiple surgeons come through and teach them advanced surgical techniques so that they can bring that back to their own hospital. The patients benefit from the knowledge that we share here at the Nicholson Center because they're able to receive cutting-edge surgery that leads to better outcomes and quicker recovery.
The final piece of the equation, of course, is utilization of the knowledge. If we generate knowledge and teach others that knowledge, then it's clearly vitally important that we apply that knowledge to the benefit of our patients.
Here at the Center for Colon and Rectal Surgery, we can afford our patients to have the best possible outcomes by doing minimally invasive surgery approaches. These would include robotic surgery, laparoscopic surgery, transanal approaches. This could possibly allow a patient to get out of the hospital in a quicker manner, back to work sooner, and onto their normal daily activities.
ERAS stands for Enhanced Recovery After Surgery. It's a program that tries to streamline the patient care from the experience of preoperatively, perioperatively, and postoperatively. The team approach is very effective in the ERAS program in that we involve everybody from the patient, their family, all the ancillary hospital staff, including the nurses and physicians. By having everybody take an active part in not only participation of care, but education, we feel that we are on the road to have higher quality outcomes.
It's always important to improve on what you're doing. And what we do is certainly is the greatest thing, making things better for patients, making outcomes better for patients, having them recover from surgery with less trauma and stress, and helping them get back to their lives in a more normal fashion.